In this section, I'm going to talk about assessing communication abilities in individuals with right hemisphere disorder, traumatic brain injury, and dementia. Before I get into the details of assessment or the content of the lecture, a couple general statements. First of all, I personally find assessing the communication abilities of persons with right hemisphere damage, traumatic brain injury, assessing them, understanding how to treat them, fairly difficult and difficult to grasp. And I think that makes sense because with our patients with aphasia, their problems in some ways are much more concrete, right? Their naming problems are very obvious. We can test their auditory comprehension, their reading and writing in ways that are very understandable. But in general, the communication problems of individuals with right hemisphere disorder and traumatic brain injury are at a high level of language. In other words, they don't have problems with the linguistic units, word finding per se. They can, but in general, they have more difficulty with discourse and pragmatics and the non-literal aspects of communication, understanding, being able to inference, to understand implied meanings. Of course, we also have, with particularly right hemisphere damage, the ability to perceive affect, both in facial expression and prosody. And so these are behaviors that by their very nature subtle. I think that sometimes some of the issues are obvious, but oftentimes I think what we feel when we're communicating with patients who have these kind of problems is that something is off. For lack of a better word, we may find them that they have a personality that's disagreeable or odd. They're somehow odd communicators. We could go on with qualifiers like that. But this should set off warning bells in our head that these feelings that something is odd about the way this conversational exchange is going or how this person presents, that should be a sign to us to think about why, and to remember that they can have these high-level language problems, and sometimes those gut reactions we have are the first indicators that there's something there that we need to investigate more. In general, except for some individuals with TBI who have localized damage to the language zones of the left hemisphere, or patients with primary progressive aphasia, except for those populations, aphasia batteries in general are not appropriate unless we, for example, take out certain subtests that look more at discourse in the aphasia batteries, such as a picture description task or the free conversation task in the BDAE, short story comprehension, things like that. You'll note a theme through the notes on this lecture, and that is that we don't have a lot of choices when it comes to standardized measures of communication abilities for individuals with right hemisphere disorder, and TBI particularly. I list some of the tests, and the author Murray and Clark describe some of these tests. I'm not really going to go into them in detail, you will find that you will use the test that is in your clinic. But I think if you peruse through the notes and some of the descriptions of the tests, you'll certainly see some themes emerging with regards to the kinds of behaviors that are assessed. So one theme with regards to assessing communication in individuals with right hemisphere disorder, TBI, and to some degree dementia, is that our assessments are focused on discourse and pragmatics. As I mentioned in the notes, much of the approach that we take to assessing these abilities are the same. In other words, it's very similar how we go about assessing and understanding these problems in individuals with right hemisphere damage and TBI. There are some differences with right hemisphere disorders. They're more likely to have difficulty with the production and comprehension of affective or emotional signals, such as production and comprehension of prosody. In general, I find that most SLPs kind of have informal measures to assess these. Your authors in your text mention one or two batteries to assess prosody. I don't know anybody who's ever used those. Some of the batteries for right hemisphere disorder do have short sections where prosody is assessed through producing different emotional tones for the patients to perhaps listen to and match to pictures of facial expressions, or having the patients produce different emotional kind of tones in their speech. So that is one difference. Another difference is with reading. Persons with right hemisphere disorder, of course, oftentimes have left neglect. So that is a kind of a distinct issue with patients with right hemisphere damage, unless the traumatic brain injury also resulted in something like localized right hemisphere damage, particularly to the parietal lobe. So we can get what we would call neglect dyslexia or neglect dysgraphia. So neglect dyslexia means that a person only they ignore the left side of the page when they're reading, so they might start in the middle of the page and read to the end. When they're writing, they on a piece of paper, they may start in the middle of the paper or somewhere around there, and then write off to the right. With both right hemisphere disorders and TBI, we can get what some people have called an attention dyslexia, and that is difficulty. Essentially, it's difficulty comprehending what one's reading and keeping one's place on the page because of attention problems. But the focus in both right hemisphere disorders and TBI is going to be on assessing discourse and pragmatic skills. Because assessing and understanding these high-level communication skills, discourse, pragmatics, can be difficult, I find it useful to pay extra careful attention to patients' complaints, caregivers' observations, spending an adequate time talking to patients and caregivers about how they're functioning. out in the world. If they're an outpatient, that can definitely help us identify some of the kinds of problems that patients may have with their communication skills. Obviously, there's just a valid reason for doing that, because we want to improve their functioning out in the real world, and so we need to know how they do out there. We should be mindful that individuals with right hemisphere damage and TBI often have or significantly poor deficit awareness, and so and poor metacognitive and metalinguistic skills, and so they may not be accurate, good reporters of the types of problems that they're having out there. And so sometimes caregivers will give us a more objective observation, and the discrepancy between what a caregiver reports and a patient reports is often one of the ways that we basically assess whether a person has poor deficit awareness. And that's strengthened if you, as the clinician, are also observing similar things to what the caregiver is. And so the two of you agree, but the patient doesn't think they have as much problems. And so that's a fairly clear indicator of poor deficit awareness.